नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. प्रुडंट मिडियाच्या हॅलो दोतोर ह्या कार्यावळीन दर फावटी आमी तरेकवार विशयांची माहिती दितनाच एकदा अशा तज्ञ लोकांक आमी तुमच्या समोर हाडले जांकां सहसा मेळप तुमचे कडेन किंवा तुमचे कडेन भासाभास करप बरेच डिफिकल्ट आसता, कश्टदायक आसता. आनी आज ही कार्यावळ आमी एका व्यापक मोहिमेचेर वतना म्हाका दिसता की आज म्हजे बरोबर 7 एक्सपर्ट्स आसात विक्टर हॉस्पिटलचे मडगांवच्या. आणि हे 7य दोतोर आमी एकच जुटीन म्हणटा तशें कॅन्सरच्या आड हें झूज चालू आसा. हे कॅन्सरच्या आड जेन्ना झूज आमी म्हणटा तेन्ना फक्त ही गव्हर्मेंटची जबाबदारकी किंवा प्रायवेट प्रॅक्टिशनर जबाबदारकी अशेंच आसतना तर हातूंत सगळ्या तरेचे लोक येतात. तो एज्युकेशनलिस्ट येता, शेतकरी येता, बाकीचे लोक येतात आणि ह्या सगळ्या झुजान आमी सगळ्यांनी एकठांय येवन म्हणजे हांव केन्ना केन्ना म्हणटा की हें फक्त डिपेंडंट किंवा इंडिपेंडंट न्हय तर इंटर डिपेंडन्स हो जो शब्द आसा की आमी जशे कपड्याचे धागे उबे आणि आडवे असतात तसे उबे आणि आडवे जाळी जेन्ना जाता तेन्नाच तो धागो आणि तो कपडो घट्ट जाता. आणि हे झूज आमी सगळ्यांनी मेळून आमी फुडें व्हरतना आज जेन्ना म्हजे बरोबर हे तज्ञ दोतोर आसात आमी वेगवेगळे विशय घेतले, वेगळे विशय विस्कटान तुमकां माहिती सांगतले आणि ह्या माहितीचो संदर्भ तुमच्या जिवितान येवचो, तुमच्या जिविताक एक नवें इन्फॉर्मेशन मेळचें, नवो आयाम मेळचो आणि ह्या कॅन्सरच्या झुजा कडेन आमी सगळ्यांनी एकठांय जावन झगडचें होईच आमची मोख आसा. तेन्ना म्हाका तुमच्या समोर आयचे जे आमचे म्हजे बरोबर टीम आसा आय विल कॉल देम म्हणजे सप्तर्षी 7 ऋषी म्हजे बरोबर आसात ज्ञान तपस्वी. ह्या ज्ञान तपस्वींची ओळख करून दितना म्हाका खूब खोस भोगता. म्हजे बरोबर आसा डॉक्टर अविनाश आनंद, सर्जिकल ऑन्कॉलॉजिस्ट. म्हजे बरोबर दुसरे डॉक्टर आसा डॉक्टर अर्शद हुसेन शाह, मेडिकल ऑन्कॉलॉजिस्ट. डॉक्टर आंतोनियो फिगेरेडो, न्यूरोसर्जन. डॉक्टर जोज फिलिप अल्वारिस, गॅस्ट्रोएंटरॉलॉजिस्ट. डॉक्टर मधुजा सावयकर, युरोलॉजिस्ट. गौरी अणवेकर, डॉक्टर गौरी अणवेकर, MD पॅथॉलॉजी म्हणजे सगळे लॅबांचे सगळे जे आसा म्हणजे तज्ञ ती डॉक्टर आसात. आणि डॉक्टर फ्रॅन्झिल मिरांडा जे रेडिओलॉजिस्ट जावन आसात. म्हणजे तुमकां सुरवातीकच कळ्ळें आसतलें की ही आयची टीम आसा इज समथींग डिफरंट. दीस इज अ गॅलेक्सी ऑफ सुपरस्टार्स. आय कॅन टेल इट अ सुपर वॉर म्हणटा तशें. आणि ह्या खातीर आमचे सगळ्यांचे एकठांय येवन आमचे सगळ्यांचें योगदान हें खूब म्हत्वाचें आसा. आणि हें योगदान फक्त आमचें न्हय तर ह्या योगदानान तुमी सुद्दां आमचे बरोबर वांटेकरी आसात हें मतीन आसूनी. तेन्ना आयची कार्यावळ पळयतना जर तुमच्या पैकी कोणूय भायर भितर आसात जाल्यार तुमी सगळ्यांक आपोवचें. आणि कारण आयच्या कार्यावळींतल्यान तुमकां अशी मोलादीक माहिती एकाच वेळार मेळटली जी म्हाका दिसता सहसा आमकां केन्नाच मेळूं शकना. इट इज व्हेरी डिफिकल्ट टास्क. आमकां हें ऑर्गनायज करतानाच इतको टफ टायम आला की रियली इट इज आय शूड से बट वी हॅव टेकन दीस चॅलेंज. तेन्ना आय वूड लायक टू कॉल अपॉन डॉक्टर अविनाश आनंद जे सर्जिकल ऑन्कॉलॉजिस्ट आसात आणि ते आमकां ह्या विशयाची माहिती दितना सगळ्यात पयलीं वॉट इज अ सिनारियो इन गोवा स्पेशली बिकॉज वेन वी कंपेर दिस थिंग ऑफ स्टॅटिस्टिक्स ऑफ गोवा विथ नॅशनल स्टॅटिस्टिक्स figures are little alarming, figures are little high, and it is also a word of caution for everybody की हे सगळ्यांकच आमकां जाणून घेवपाची गोंयची संख्या आमचे कॅन्सरच्या रुग्णायतांची वाडटा. पण हेजें कारण कितें आसा ती फक्त लोकां मदीं अवेरनेस आसा म्हणून ते रजिस्टर वता म्हणून तेंची संख्या वाडल्या काय खरेंच ही संख्या वाडल्या. आनी जर ती वाडल्या जाल्यार कित्या खातीर वाडल्या, वॉट आर द कॉजीस, हाऊ वी कॅन डू टू कंट्रोल इट, how we can give a word of mouth or a propagation of the ideas so that everything comes under control. Doctor.
Yeah. So currently what is happening in the state of Goa is the number of cases when compared to other states in India, it has considerably increased. For example, if you check into the cancer registry of India, in the year 2020 in Goa, the number of cases identified were 1,500. 2021 it has become 1,600 and this last year it is 1,800 cases. That means it is every year the number of cases are increasing. But the worst thing about the cancer cases are the percentage of death from the cancers is almost 50%. That means in the year 2022 out of 1,800 cases nearly 900 patients lost their lives because of cancer. So this is not something a small number. What I mean to say is 50% of people who are diagnosed of cancer are not surviving. So that is something very alarming and something which has to be taken very serious about it. So in Goa currently because of lifestyle practices, I would say that the colon cancers, breast cancers are increasing in number every year. Mainly I would say probably because of the dietary habits, more consumption of processed food, red meat, constipation And even breast cancer mainly because of delayed marriages, no childbirth, not breastfeeding the babies, and multiple factors. And definitely you should not forget tobacco and alcohol consumption. This has always been one of the major risk factor for cancers throughout the world. And in the coming years, I would always say one another important risk factor for all cancers are obesity. Based on various studies, various research, multiple publications have recently announced that obesity is the major risk factor for cancer. You take any medical problem, you talk about cardiac diseases, you talk about stroke, you talk about cancer, everything is linked to obesity, which directly translates to the lifestyle. So you practice a very healthy lifestyle, you try to be fit, go for a walk every day, try to eat healthy food, your life becomes much easier. So cancer is one disease which is becoming the most common cause of death throughout the world after cardiac diseases. So this is something which every person needs to understand the various risk factors and practice a good lifestyle.
So basically, when we are talking about cancer, it is, you can say that it is more of a lifestyle disease, as we are talking about diabetes or hypertension or any other cardio-related problem. Cancer is also becoming a lifestyle disorder, and you have already suggested that we should have good healthy practices as far as our eating habits are concerned, as far as exercises are concerned. Doctor, I would like to ask you one other important question. Is this number in Goa has increased because we have got registry and it is diagnosed on time or in time, and that's why we feel the number is bigger, or it is actually bigger?
I would say this is just the tip of an iceberg.
Oh.
The numbers what I gave is actually very less. These are the numbers which are reported to the hospital. But when you go to the rural part, very interiors of the villages, there are a lot of patients who die because of cancer, who do not come to the hospital. And the worst situation is a lot of people who come to the hospital, they usually come in stage 3 and stage 4. So why this is very important is because when you come to the hospital in stage 1 and stage 2, we call it as the early stage. So the treatment is very simple, the cost is very minimal. Maybe the patient can just undergo a surgery. Sometimes even radiation therapy, the cancer is cured 100%. But when they come in stage 3 and stage 4, the patient might need multiple treatments in the form of surgery, radiation therapy, chemotherapy, and even the outcome is very poor. So this is what is happening not only in Goa, throughout the world. Patient come to the hospital very late, and that is why we lose patients.
Okay. So, doctor, thank you very much. You have given a lot of insight, I should say, and it is a word of caution for all of us who are watching this program and who are part of this health system. Apart from the part of the health system, we as the citizens of Goa or for the country or whatever it is, we have a big role to play, because it is finally, as you have mentioned, is a lifestyle disorder. Dr. Arshad, what I would like to know from you, what are the facilities available in today's world? Because the change, there is a dramatic change, the treatment 20 years back and treatment today, and whether it is chemotherapy or targeted therapy, all these things are coming into picture. What you would like to say in the current scenario when we are managing the cancer patients?
Now, before we used to treat cancer from medical oncology point of view with chemotherapy only, but now we have a lot of options available, where we have target therapy, immunotherapy, we have hormonal therapy, and we are doing for the patients, we are doing diagnostic screening workup. We are finding some biomarkers which can have them, which can give clue about the prognosis of the disease, and which can give the treatment options that we can find target with this.
So, because once upon a time, I'm telling you, means again, my point is simple. Whenever people, whether educated or uneducated, the moment you say we have to put you on chemotherapy, they used to say, I prefer not to take chemotherapy, even educated people, because the toxic or the side effects were so much. But what I recollect from your statement is that the days are changing. So what is that change which has brought, and now I think that chemotherapy should be considered patient-friendly management treatment and should be accepted by as and when required or as and when suggested by the doctor. So what is that newer thing? Like, see, you have mentioned about the targeted therapy. So you just elaborate what you mean by targeted therapy, so that people will understand what is exactly the role of these medicines.
The chemotherapy has taken the back seat in many tumors. For example, lung cancer, we now know there are many genes that are driving the cancer. So we find these genes through a molecular test. If we find some targets, so we will give the target therapy only. that will target the drive who is driving the mutation gene who is driving this cancer. So that chemotherapy is not needed. In case there is mutation in coming days in that gene, we can change the treatment also with this one.
ओके म्हणजे डॉक्टर हे सांगतात की समजा आम्ही अशें समजुया की एका गांवांत एक चोर आयला जाल्यार तो आख्खो गांवूच पुलिसांनी सगळ्याक तांकां बॉम्ब ब्लास्ट करपाची गरज ना तर ज्या घरान तो चोर लिपला तें घर आमी आयडेंटिफाय करूं शकता आनी अकॉर्डिंगली आवर पोलीस फोर्सीस कॅन कॅच द कल्प्रीट. सो सेम वे वेन वी आर टॉकिंग ऑर डिलिंग विथ द कॅन्सर पेशंट देर इज नो नीड ऑफ बाबा सगळेच तुका सगळे आख्खे शरीरभर तुका हेचे टॉक्सीक इफेक्ट येतले अशें ना. तर ज्या जाग्यार तो एक्टिवेट आसा किंवा एक्टीव आसा त्याच जाग्यार ट्रिटमेंटाचो एक्टीव रोल हाडूं शकता आणि त्या प्रमाणे ते मॅनेजूय करूं शकता. इट इज अ रियली गुड थिंग विच हॅज हॅपन. डॉक्टर, आय वूड ऑल्सो लायक टू नो अबाउट द सायड इफेक्ट्स. वॉट आर द, बिकॉज पीपल इज टू गेट लॉट ऑफ नॉशिया, हेअर लॉस अँड ऑल दीस थिंग्स इज टू हॅपन. So what is the current scenario today?
The chemotherapy side effects are lot rather than target therapy. Chemotherapy, we have lot of side effects depending upon the drugs. Some have heart, cardiac toxicity. Some have skin toxicity. They have alopecia. They have skin rashes. Some have GIT. They will have vomiting, nausea, enteritis, loose motions. Some have hemorrhagic loose motions. So with target therapy, there are not so much side effects with target therapy. Yeah. There are very less side effects and that are usually manageable. And we keep monitoring these side effects from the beginning. So with target and immunotherapy, side effects are 90% less than the chemotherapy.
ओके, व्हेरी गुड. म्हणजे डॉक्टर सांगता की 90% जे सायड इफेक्ट आशिल्ले ते आमी कंट्रोलान हाडूं शकता ह्या टार्गेटेड थेरपीक लागून. सो दीस इज वन ऑफ द मोस्ट एक्सेप्टेबल असा मीन्स आणि ताचो फायदो पेशंटाक किंवा रुग्णायकाक जावं शकता. डॉक्टर, वॉट यू मीन बाय किमो पोर्ट, वॉट वी युजली एडवोकेट, वॉट इज रोल ऑफ दॅट?
So because whenever we are giving chemotherapy, the treatment is for long duration, for 5-6 months, 3 months. So repeatedly we are giving chemotherapy or any drug that causes this veins to shrink and then inflammation. So then in the coming days it is becoming very difficult for cannulation, giving medicines, and sometimes this drug can go out of the vessel and it causes some necrosis, some side effects, severe side effects. So with the chemo port, we are just doing a small incision near the collarbone, and there's we are putting this chemo port cannula directly into the large vein, superior vena cava.
अच्छा.
So the chemo can be given without any side effect, without risk of any extravasation, and we can use it for many years. Just they have to come monthly for some flushing, for some. So that's.
Okay, doctor, when we are talking about the management or treatment of cancer, there is also important role of rehabilitation. What is that scenario in today when we are dealing with cancer patient as of today? So how they can be rehabilitated or can be brought back into the productive life?
Yeah, now if the cancer is detected early, so the cure rate is very high. So in that case, for example, patient with stage 1 disease in breast cancer, most cases this only surgery will be enough. So in that case, so patient will be rehabilitated easily. But if the patient is taking long-term treatment for long duration, and then it will take time. It depends upon what kind of surgery, what kind of treatment, what kind of diagnosis it was. For example, patient with amputation, sarcomas, so they have to, after surgery and chemotherapy, long-term side effects, and then they need rehabilitation for a long time.
Okay, so now the days are changing and we can very well say म्हणजे जशे डायबेटीक प्रेशराचे दुयेंस आशिल्लो मनीस जसो जगतालो आपली वखदां घेवन किंवा जगता, त्याच प्रमाणे आजच्या ह्या सिनारियोन कॅन्सरची वखदां घेवन मनीस सुशेगाद आरामान, हांव एकदम हेल्दी असो म्हणना पण जगू शकता. इट इज व्हेरी गुड थिंग. म्हणजे डेज आर चेंजिंग. डॉक्टर अंतोनियो, यू आर डिलिंग विथ न्यूरोसर्जरी, व्हेरी कॉम्प्लिकेटेड फील्ड. कारण म्हाका दिसता की असो खंयचोच म्हणजे असो मनीस आसचो ना द मोमेंट यू टेल हिम समथींग इज रॉंग अँड दॅट टू मॅलिग्नन्सी, की तुज्या ब्रेनान खंय तरी ट्युमर आसा किंवा मॅलिग्नन्सी आसा, कॅन्सरचें लक्षण आसा, आय थिंक 99.9% द मॅन वील कोलॅप्स. ऑन दीस बॅकग्राऊंड, वॉट यू वूड लायक टू एडवायज और वॉट यू लायक टू टेल अस अबाउट युअर फील्ड एज ऑफ टुडे इन करंट सिनारियो?
कितें आसता, ब्रेन ट्युमर्स आनी स्पायन ट्युमर्स दोन टायपचे आसता. एक आसता बिनायन. So the benign tumors are purely curable. So if you give the patient treatment on time, they can be completely freed of the disease. Any malignant tumors they can be directly arising from the brain or elsewhere from the part of the body and then spread to the brain. That's where we have this multidisciplinary approach where we involve all the departments. Spine cancers also can arise from anywhere else or also from the spine. So if they come from the prostate and those type, then we involve the urologist. Okay, so this is where we have a multidisciplinary approach involved. Now the symptoms of brain tumors are very different compared to spinal cord tumors. Brain tumors present more depending on their location. आता जे ट्यूमर उलोवपाच्या जाग्यार आसा ते उलोवपाक त्रास करतले. If it is very close to the area controlling the part of the body, you will have weakness. And if it is very close to the hearing nerve, आयकपाचे जे नस आसा त्याच्या सायडीन आसा जाल्यार उलोवपाक आयकूंक बी त्रास जावंक शकता. So it's very important to pick up the symptoms early. And spine tumors will present with back pain, कमरेन दुखता, रातचे जे दुख जाता ती मेनली स्पायनल कॉर्ड ट्युमर्साची आसता. आणि रातचे जे पायांनी जे करंट मारता, ते पायांनी विकनेस आसता, मुळे मारता, ते सगळे सिम्पटम्स आसूं शकता. आता कितें आसता, इनिशियली when the diagnosis of brain and spinal cord tumors was there, the outcome was not good कित्याक आमचे कडेन इक्विपमेंट बी चड नाशिल्ले. आता मायक्रोस्कोप कितें आसता, हर शीर आतां जे धाकटी दिसतले आतां सारके व्हडली दिसता, मॅग्निफिकेशन इतलें आसता, क्लियर आसता, इल्युमिनेशन आसता. आणि आता मी एंडोस्कोप बी यूज करता, सारके ब्रेनान भितर पावता आणि नॉर्मल ब्रेनाची डॅमेज भरपूर कमी आसता. देन इंट्रा ऑपरेटिव्ह न्यूरो मॉनिटरिंग यूज करता. न्यूरो मॉनिटरिंग म्हणल्यार नॉर्मल ब्रेनाचे जेन्ना डॅमेज करता ते आमकां सेन्सराचेर कंप्युटराचेर कळटा.
अच्छा.
So we are very specific with what we are dealing with. We are targeting our activities and we are able to give much better outcomes. Right? And of course the use of the high-speed drills and all has enabled us to go right to the base of the skull. आणि now even the methods of controlling bleeding, केन्ना केन्ना ट्युमर्स चड ब्लिडींग बी जाता, तांकां कंट्रोल करपाक बी भरपूर न्यू टेक्नॉलॉजी आयिल्ली आसा. So we are far better equipped to deal with all these problems now.
So I can say at least in your field you are more techno-savvy person. म्हणजे आज अशी वेळ आसा की फक्त वखदांचेर डिपेंड आसा. स्पेशली ब्रेन ट्युमर जेन्ना आमी उलयता तेन्ना ब्रेनाच्या खंयच्या पार्टाक तो ट्युमर आसा. एक्झाम्पल म्हणजे समजा आमच्या घरातली किचनातले लायटीचो फ्यूज गेला जाल्यार ओन्ली दॅट पार्ट वील बी अफेक्टेड, युअर बेडरूम वील बी नॉर्मल. सो सेम वे जशें म्हटल्या डॉक्टरान की जर समजा तुमचो ज्या उलोवपाच्या भागाचो समजा जो सेंटर आसा तो जर अफेक्ट जाला जाल्यार आमचे उलोवपाचें अफेक्ट जावंक शकता, किंवा ज्या प्रमाणे हात पांय चलता किंवा आमचे बाकीचे आयकूंक येता किंवा आमी बाकीच्यो एक्टिविटी चलता, उलयता, दिसता, त्या भागाक जेन्ना जेन्ना अफेक्ट जाता, म्हणजे त्या भागाक समजा ट्युमर जालो किंवा कॅन्सराची लक्षणां दिसून आयली जाल्यार तो भाग अफेक्ट जावंक शकता. आणि डॉक्टरांनी आनी एक नवी गोष्ट सांगली विच इज व्हेरी इम्पॉर्टंट एज ऑफ डेट. म्हाका दिसता की इम्पॉर्टंट हें आसा की आज तंत्रगिन्यान तांच्या फिल्डान खूब ताचो आस्पाव जाला आणि ह्या तंत्रगिन्यानान मनशाची जगपाची आशा आणि इच्छा प्रबळ केल्या. इतकेंच न्हय तर आज मनीस बऱ्या तरेन आपलें फुडलें उर्वरीत आयुश्य घालोवंक शकता. कारण ताका जशें पयलींच्या फूल जशें हांवें सांगिल्लें की फूल कंपार्टमेंट काडनासतना जो पार्ट अफेक्ट जाला त्या पार्टा पर्यंत आज तुमचे एक्सेस आसा आणि इट हॅज रियली ओपन अ न्यू डायमेन्शन्स, न्यू हॉरायझन्स अँड गिवन अ न्यू रे ऑफ होप टू द पीपल हू आर सफरिंग विथ दीट. डॉक्टर आनी तुमकां अशें विचारता, कारण खूब फावटी आमी अशें पळयतात की आमचे कडेन पेशंट असतात की जाका एक क्रॉनीक मायग्रेन म्हणा किंवा वर्टायगो म्हणा, किंवा जाका घुवळ येवप किंवा आपले एक सायडीक दुखप, एक सायडीक अर्धशिशी जाका म्हणटात, अशा तरेचे पेशंट असतात आणि दे रिमेन फॉर अ लॉंगर टायम किंवा ते आपले आपूण डायग्नोज करतात किंवा कोणा कडेन वचून म्हणटा की ना आपल्याक अर्धशिशी आसा किंवा घुवळ येता, वर्टायगो आसा किंवा स्पॉन्डायलायसीस आसा, हे आपल्यान जे ओन डायग्नोसीस आसता किंवा केन्ना केन्ना डॉक्टर. पण म्हणजे म्हाका अशें तुमकां दिसून येना की केन्ना केन्ना हीच बारीक बारीक लक्षणां कॅन बी अ सायन अँड सिम्पटम्स ऑफ द major disorders in the brain.
Definitely, 100% this is one of the most common symptoms. कितें आसता, एक ट्युमर आसता ताका म्हणटा एकॉस्टिक न्यूरोमा. इट कम्स फ्रॉम द हियरिंग नर्व. ताजे मेन सिम्पटम्स आसता कानांनी कितें आवाज येवं, कू कू तशें आवाज जाता, मागीर वर्टिगो बी येवं शकता आनी बॅलन्स बी वयता. स्मॉल ब्रेन जे आसता ती बॅलन्स मेंटेन करता. त्याच जाग्यार जेन्ना ट्युमर आसता आमची बॅलन्स बी एफेक्ट जाता. पेशंट स्ट्रेट चलपाक जायना, like alcoholic तशें चलता, कळ्ळें न्ही. सो इट इज व्हेरी स्पेसिफीक. ऑल दीस सिम्पटम्स कॅन बी अ क्लियर इंडिकेटर ऑफ अ ब्रेन ट्युमर. सो इट शूड नॉट बी टेकन व्हेरी लायटली.
सो हो जो